Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Globular global series or edition, this audio podcast as part of a Lunar Insurgence, this audio podcast as part of a Skelter Lobostics, this audio podcast as part of a Storm Lobostics production. In this audio podcast, a little bit of an overview of sickle cell anemia or SCA and thalassemia, and in around sort of the pediatric population. So in around 2016 or 17, the NHS or National Health Service screening for SCA and thalassemia program identified around 274 neonates around 274 neonates in United Kingdom with SCA, and a further 8,530 neonates as carriers. One investigation evaluated SCA care from 2004 to 2019, a period during which treatment approaches for pediatrics or young people with SCA have changed significantly. The changes included the expanded use or utilization of hydroxyurea, which can reduce the severity of anemia and lower the risk of SCA complications. At the same time, and sort of as an overview, there were 5,316 unique pediatrics or young people in the ages between 2 years of age to 18 years old with SCA SCA in that time, i.e. between 2000 around 2000 between 2004 and 2019. And at the same time, yeah, there were 5,000. There were 5,316 unique pediatrics ages between the ages of 2 to 18 years old with SCA which had been identified or screened between 2004 and 2019, and where they were enrolled in a enrolled into into the Georgia Medicaid from 2004 to 2019. And pediatrics receiving any transfusion increased from 2004 to 2010, then stabilized. In SCA patients or recipients, chronic transfusion initially increased from 2004 to 2010, then stabilized from 2010 to 2019. And so for chronically transfused pediatrics, monitoring of iron burden and filled chelator prescriptions both increased significantly. Hydroxyurea use in SCA patients increased from 12% to 37%, with increases noted within each age group, most notably from 21% from 21% to 60% in the 13 to 18-year-old cohort. And so while trends in clinical management do follow updates in treatment guidelines, there is sort of a still delayed and suboptimal uptake of guideline recommendations in pediatrics or young people in around SCA. That draws this audio podcast to a close. This audio podcast as part of a Globular Global. This audio podcast as part of a Lunar Insurgence. This audio podcast as part of a Skelter Lobostics. And this audio podcast as part of Storm Lobostics production.